Question number 10, the Honourable Annette King.
My question's to the Minister of Health. Does he take responsibility for the health outcomes from his policies? If not, why not?
Honourable Tony Ryle.
Mr Speaker, as Minister, I take responsibility for the overall performance of the New Zealand Public Health Service, including responsibility for the big increase of over 37,000 extra patients who have received first specialist assessments under this government.
Supplementary question, Honourable Annette King.
Does he take responsibility for DHBs which are once again this year sending letters to GP clinics saying due to the current resources available and increased demands, they will only be accepting urgent referrals to the hospital, something that he claimed in Parliament in March did not reflect what was happening? And is he aware GPs are now reporting patients with significant impairment and pain are not getting timely treatment and are saying that the real number of patients waiting to be seen is being hidden?
Honourable Tony Ryle.
Mr Speaker, I would have to say to any of those claims that the real number of patients being hidden is what's going on is not correct. That member will recall that in fact it was her party opposite that slashed 36,000 people from waiting lists in order to hide the true number of people waiting.
Point of order, Honourable Annette
I seek
King.
leave to table a letter from the Hutt Valley DHB to GP clinics saying that they will only accept urgent referrals under his watch. Nothing to do with 8 years ago.
Order. Leave sought to table that particular document. Is there any objection? There is none. It can be so tabled. Point of order, Honourable Annette King.
I seek leave to table a letter from a GP clinic saying that their patients have significant impairment and pain because they've been denied timely treatment, and they're stopping referring these patients hides the real numbers under his watch.
Leave sought to table that particular letter from a GP clinic. Is there any objection? There appears to be none. It can be so tabled. Supplementary question, the Honourable Annette King.
Does he take responsibility for Mrs Holland of Hawke's Bay, who has received a letter telling her she can't be seen because of current resources and capability, even though she keeps falling over and is permanently on a walking stick? Or Mrs Bennett of Mid Central, who's been refused an appointment because only urgent referrals are being accepted, even though she's unable to walk more than a few steps? Or Mr Greenwood from Capital and Coast, who's been refused an appointment and has been forced to stay on the sickness benefit for 2.5 years? Just some of the growing numbers of cases emerging under 5 years of his stewardship.
Order. Honourable Tony Ryle.
Mr Speaker, I would have to see the full story behind those claims, because I am aware that that member made a claim of a large number of people who were missing out on services of the District Health Board on the basis of a doctored OIA request that she then had to apologise for the claims that she'd made.
Order. Point of order.
I seek leave to table the amended numbers of colonoscopies from South Canterbury the Minister is talking about. They had to amend them because they made the mistake, not me.
What is the source of the What is the source of the document?
It is a report from South Canterbury DHB to me to correct their mistake.
Leave sought to table that particular report from the South Canterbury DHB. Is there any objection? Appears to be none. It can be tabled.
Supplementary question, Mr Speaker. Supplementary question.
Point of order, the Honourable Tony Ryle.
Mr Speaker, I seek to table an Official Information Act response to Mrs King from the South Canterbury District Health Board, which shows the numbers were changed.
Leave sought to table that particular document. Order. Order. Would the member please resume her seat? Leave sought to table that document. Is there any objection? There is not. It can be so titled.
Supplementary question, Mr Speaker.
Supplementary question, Honourable Annette King.
Does he take responsibility for the shocking health outcome for an elderly woman in a retirement village hospital in Wellington, who was found covered in faeces on 3 separate occasions, care that was called disgusting by her daughter, because he has failed to implement recommendations from 3 significant reports into care of the elderly, all released under his watch, his 5 years as Minister, which included recommendations around low wages paid to carers, around training and staffing levels.
Honourable Tony Ryle.
Mr Speaker, I was shocked and appalled to see the level of that care being provided in that facility, and it's simply completely unacceptable. The government has put $184 million extra into aged residential care, and what I can tell that member is I'm interested she's now suggesting there should be minimum staffing ratios in rest homes, because when she was Minister, she ruled that out.
Order. I have a point of order. It will be heard in
Mr Speaker,
silence.
I seek leave to table the Human Rights Commission report talking
Order,
about...
order. That report would be available to all members.
Table the Audit Office report about
Order. The member is now starting to waste the time of this House by attempting to table documents that are available to any... Order. If the member also wants to stay for the balance of question time, she needs to be careful about points of order that she raises. Question number 11, David Bennett.
Mr Speaker, my question...
Order. Order. Would the Minister please... Order. David Bennett, question number 11.
My question is...